That's the American Lung Association's Lung Force initiative, which raises awareness about the leading cancer killer of men and women. That's lung cancer. Our next guest is going to tell us who is most at risk for lung cancer and some tips to combat it. Here's Dr. Andrew Martin, the chair of pulmonary medicine at Deborah Heart and Lung Center. Welcome, doctor.
Good morning, Jenna. Thanks for having me.
Thank you so much for being here. Such an important topic. And according to the American Lung Association, smoking poses the greatest risk for lung cancer, but there are others. So can you tell us some of those?
Well, there are several occupational risk factors, particularly exposure to asbestos and other chemicals and other kinds of smoke or particulate inhalation.
And you do have some tips for our viewers today. And the first tip, of course, to quit smoking. So tell us more about smoking's effect on the lungs.
Well, it can cause several illnesses, emphysema, chronic bronchitis, and of course, lung cancer. It can also cause just an annoying cough symptom with normal lung function.
And your next tip, doctor, is to do some cardiovascular exercise. And does this help combat lung cancer, and how does it help?
Well, it helps you keep in good shape overall. Exercise is good mainly for the heart and the vascular system, which helps the lung and the heart together work better.
And it's also important that we don't ignore symptoms. Let's talk about some of those symptoms. What should we look out for?
Well, symptoms of lung disease are abnormal shortness of breath, cough, chest tightness, wheezing, things like that. It has to be remembered that a lot of other things can cause simple shortness of breath. When it comes to lung cancer, however, it's really important to remember that often by the time lung cancer causes symptoms, it's too late to cure it. And that's why the recent recommendations and the development of effective lung cancer screening are so important.
So if some of our viewers find that they may have some of these symptoms, what should they do about it?
Well, they should talk to their primary doctor. And if they do have lung problems and they have a pulmonologist, it's important to talk to them. But again, it's important to understand that asymptomatic smokers will still be eligible for lung cancer screening. Those would be people between the ages of 50 and 80 years old. If they have smoked more than 20 pack years. A pack year is one pack a day for a year or half a pack a day for 2 years. So if you're between 50 and 80, have more than 20 pack years of smoking and have smoked within 15 years, you are eligible for lung cancer screening using low radiation CAT scans. And the purpose of that is, at any screening test, is to find curable cancers.
All right, doctor, important information there. And do you have any more tips that you can share for us that our viewers should look out for?
Well, if you don't smoke cigarettes, don't start. And if you do smoke cigarettes, make an attempt to stop. Make a plan to stop and give it a try.
Great. And where can we go for more information?
You can go to the American Lung Association website, which is www.lung.org. The Deborah Heart and Lung Center website, demanddeborah.org, also has information and links that people can follow.
Doctor, thank you so much for joining us this morning.
Thank you for having me.
Still ahead.